Lisdexamfetamine is one of the medications that is related to amphetamines. This medication is classified as CNS stimulant. It is a prodrug, and when it is administered into the body, it is going to be converted into its active metabolite dextroamphetamine. This medication is available as capsules and it modifies the neuronal activity within the brain. This may be responsible for reduction of hyperactivity in few of the people. It can also control the appetite and it can be used in few of eating disorders. However, lisdexamfetamine is not used as weight loss medication. So today in this video we are going to discuss about this lisdexamfetamine, how this drug works, what are the important side effects, doses, precautions, and when to avoid this medication. All such key facts we will discuss in this video. First of all, let us see clinical use of this medication. Lisdexamfetamine is particularly used in the treatment of attention deficit hyperactivity disorder, commonly known as ADHD. It is one of the hyperactive conditions that can be observed both in the children as well as in the adults. And this disorder is associated with few of the symptoms like lack of attention, difficulty concentrating, and hyperactive symptoms like restlessness in the people. In such conditions, lisdexamfetamine can be given to reduce the hyperactivity. This medication can be used both in the children as well as in the adults. However, in the children with age group above 6 years, this drug can be used. Another clinical use of lisdexamfetamine is in the treatment of binge eating disorder, commonly termed as BED. It is one of the conditions which is associated with increased appetite and increased food intake because of excessive activation of few neurons that stimulate appetite centers in the brain. Lisdexamfetamine can modify these neuronal activity, thereby can reduce the appetite in such people. However, this medication is not useful in the treatment of obesity and it is not used as weight loss medication. It is only used in the treatment of eating disorders that are associated with abnormal neuronal activity. Now let us see how it works. Lisdexamfetamine acts as a CNS stimulant. However, it is not the direct drug, it acts as a prodrug. When it is administered into the body, it is going to be converted into two fragments. One is dextroamphetamine and another one is lysine. Here dextroamphetamine is one of the CNS stimulant which is responsible for modification of neuronal activity, thereby can reduce the hyperactivity as well as reduce the appetite. However, it acts by multiple mechanisms. It can act on the presynaptic neurons where it increases the release of catecholamines like dopamine and norepinephrine. It can also act on the postsynaptic neurons where it can increase the transmission of dopamine, which may result in the regulation of serotonin reuptake. Particularly, increased dopamine transmission in the mesolimbic and mesocortical pathway can reduce the appetite that is associated with emotional response. Particularly at the presynaptic neurons, this medication reduces the reuptake of catecholamines. It blocks few of the transporters at the presynaptic neurons. For example, it blocks DAT, dopamine transporter, NAT, norepinephrine transporter. By blocking these two transporters, it can reduce the uptake of these catecholamines into the presynaptic neurons. This improves their levels within the synapse. Similarly, it can reduce the expression of few transporters on the presynaptic neurons. It reduces the number of dopamine transporters as well as norepinephrine transporters. Due to the increased dopaminergic transmission, lisdexamfetamine can also reduce the number of other transporters SCRT, serotonin reuptake transporters. All these actions collectively increase the levels of catecholamines in the brain, which reduce the hyperactivity and appetite in the people. This is the presynaptic neuron that stores dopamine, and it is a postsynaptic neuron on which dopamine can act. On the presynaptic neurons, dopamine transporters are expressed, which are responsible for reuptake of released dopamine. Now, lisdexamfetamine is a prodrug which is going to be converted into its active metabolite dextroamphetamine. This dextroamphetamine acts as a indirectly acting sympathomimetic. It can block the dopamine transporters, thereby it can reduce the uptake of dopamine. This can increase the dopamine release and their levels in the synapse. This dextroamphetamine can also act by other mechanisms. It can also block one of the vesicular transporter. By blocking these transporter, it can increase the leakage of dopamine, which is going to be leaked out of the neuron through the dopamine transporter. So this is the reverse transport of dopamine through the uptake transporters. In this way, lisdexamfetamine can increase the dopamine levels, which improves the dopaminergic transmission. Similarly, it can also increase the levels of norepinephrine and serotonin. By all these actions, this medication can control hyperactivity and appetite in the people. Now let us see the side effects of this medication. Being a CNS stimulant, lisdexamfetamine can reduce the sleep induction, so it can produce one of the important side effects, insomnia, lack of sleep. It can also produce loss of appetite, which may result in a significant loss of weight in the people. Other side effects like dry mouth, upper abdominal pain are also observed. It can also produce headache, dizziness, and anxiety in the people. Because of stimulant activity, this medication can increase the irritability, which is particularly pronounced in the children. Effect on heart. Use of lisdexamfetamine can increase the blood pressure. That's why before and during the therapy, the blood pressure should be carefully monitored. Since this drug increases the sympathetic activity, it can increase the blood pressure in the people. Similarly, this drug can also increase the heart rate that may lead to tachycardia in few people. That's why this drug is contraindicated in people with cardiac structural abnormalities. Particularly, these side effects are more pronounced in the children. So, in the children with cardiac structural abnormalities, previous history of arrhythmias, or coronary heart disease, this medication should be avoided. As this drug can affect the heart and blood pressure, any symptoms like severe chest pain, unexpected syncope leading to falling sensation, and development of cardiac arrhythmias should be carefully monitored in the people. In case of these symptoms, use of this medication may be avoided. Now let us the central effects of this medication. Lisdexamfetamine acts centrally and it acts as a CNS stimulant. However, it can also induce few of the other conditions like hallucinations in the people. So this medication is associated with development of psychotic symptoms like hallucinations and delusions. Similarly, this medication can also increase the manic phase in the people. This may result in the increased aggressive behavior and agitation. That's why this medication should be carefully used in people with bipolar disorder. Effect on growth. In the children, lisdexamfetamine can produce loss of appetite. This may result in the weight loss, which may reduce the growth in the children. However, this medication can directly reduce the growth by modifying few of the neuronal activities. Especially the retardation of growth can be observed in the children with age group 7 to 10 years. So while using this medication in the children, the height and body weight should be regularly measured, and in case of retardation of growth, this medication may be avoided. Since this medication acts as a CNS stimulant, it should be carefully used in many of the conditions that are associated with excessive sympathetic activation. Particularly in the people with hyperthyroidism, this medication increases the sympathetic activity and can further increase the risk. Similarly, in the people with glaucoma, this drug should be carefully used because it can increase the intraocular pressure. This may result in the increased blurred vision and loss of vision. And in the people with narrow angle glaucoma, this drug should be avoided. As this drug increases the sympathetic activation, it increases the blood pressure. That's why this drug should be carefully used in people with hypertension. And in those people with uncontrolled hypertension, this drug should be avoided. Another important condition is the people with agitated states. In such people, because of increased agitation, use of lisdexamfetamine can further increase the irritability and nervousness. That's why in such people, again, this drug should be carefully used. Finally, in the people with previous history of psychosis, this medication may increase the hallucinations and other psychotic symptoms. So in all such conditions, lisdexamfetamine should be carefully used, and it is preferred when our benefits outweigh the risk. Another effect of this medication is on the blood vessels. Since this medication increases the sympathetic system, it produces narrowing of blood vessels, leading to increased blood pressure. But the narrowing of these blood vessels at the periphery may lead to one of the condition, peripheral vascular disease, which may result in the blue discoloration of the skin due to lack of blood supply to the peripheral tissue. Similarly, this medication can produce prolonged erection in the adults. So particularly when this medication is used in the adults, it may produce abnormal ejaculation. Now what is the dosage of this medication? Lisdexamfetamine is available as capsules at different strengths starting from 10 mg to 70 mg. It is also available as chewable tablets for ease of administration. The dose of this medication is started at 30 mg given once daily in the morning. The dose can be slowly increased on weekly basis at a rate of 10 to 20 mg. The maximum dose is 70 mg given per day, which is slowly titrated. For treatment of binge eating disorder, again lisdexamfetamine is given at a starting dose of 30 mg in the morning and the target dose is 70 mg per day. So that's all about this medication lisdexamfetamine, which is a CNS stimulant, and this drug belongs to the group of medications called amphetamines. This is a prodrug which is going to be converted into dextroamphetamine as its active metabolite. This dextroamphetamine acts as an indirectly acting sympathomimetic. It blocks the reuptake of catecholamines like dopamine and norepinephrine. It can also block the reuptake of serotonin. By increasing the transmission of these neurotransmitters in the brain, it can control the hyperactivity as well as it can control the food intake by reducing the appetite. However, being a CNS stimulant, this medication can increase the heart rate and increase the blood pressure. So the people with cardiac structural abnormalities, this drug should be avoided. This drug produces insomnia and loss of appetite as two important side effects. However, in few people, it can increase the symptoms of psychosis and manic phase. Development of irritability can be observed in children when it is used for the treatment of ADHD. However, this medication is highly effective for treatment of ADHD and binge eating disorders. So that's all about this medication lisdexamfetamine. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button to support our work. Thanks for watching. See you in the next video.